Hi, everyone, and welcome to the show. We have a really special show. It's so unfortunate that Dr. John Phillips is on call. He's off saving the piggies. So I guess unfortunate for us, but very fortunate for whomever needs their piggies saved today at the hospital at Ohio Health. So we wish him the best. Wish him, some leg saves, some foot saves, some toe saves over there. And in the meantime, we have a great guest co-host pinch hitting for the day. We have Justin Lesh, the CEO of Patient Pro Marketing. He is live from a really cool conference in North Carolina at Dr. Sid Rao's Vascular Solutions of North Carolina, and a pretty cool topic, right, Justin? Welcome to the show, and thanks for pinch hitting.
Oh, my pleasure. And thanks for having me. And yeah, this summit's awesome. I mean, I get to go to a lot of the conventions for the vascular interventional space. This is the first multidisciplinary MSK embolization conference. And so what that means is
Muscular skeletal.
yes, musculoskeletal. But what's cool about the multidisciplinary is I've got to watch panels today with an orthopedist, a physical therapist, a pain doctor, an interventional, cardiologist, all collaborating. And how can they take better care of patients all the way from foot pain and neuropathy all the way through an MSK for their shoulder and embolization. So it's been really cool to watch.
That is because we always talk about peripheral artery disease patients, those patients that have poor circulation and mainly the legs, and how often they're misdiagnosed. More than 70% of patients who have peripheral artery disease, they present with textbook symptoms of leg pain, neuropathy, leg cramps, whatever it might be, foot burning, tingling. And more than 70% of them say that they are misdiagnosed upon first presentation of those because they're sent to the orthopedic doctor, they're sent to the physical therapist, they're sent to the neurologist, they're sent to the cardiologist, and no one ever sits there and diagnoses them. And if everybody came to the table all at once to say, okay, you have symptoms that mimic so many different things, let's all try to work together to find a resolution, these patients wouldn't fall through the cracks.
Oh, I'm hoping that we can get Dr. Singh on. I got to interview him earlier, and he's an orthopedist who works at Dr. Rao's practice. And he said the number one thing that's hurting our patients today is communication. We don't communicate as far as providers. We don't document. And so every doctor gets to play the telephone game of, what did you say last time? And it's hurting patients.
It is so sad. And really the topic that's bringing all of these doctors together is it's a new form of treatment called embolization, and it can fit under so many different umbrellas, of care. Would you mind talking about this new wave of embolization and how it fits into the conference that you're attending today?
Well, I do want to clarify, since Dr. Williams isn't here, I am not a doctor. So for anyone corrects my medical speak, but essentially with an embolization, what we're doing is that we're looking at an artery in different joints that causes issues in the synovium, inflammation, things like that. And the doctor, the IR, the vascular surgeon, is going in through a catheter and putting a tiny little embolization particle in to stop some of this blood vessels that have grown that are contributing to the inflammation, contributing to the pain. Yeah. And it's interesting today, we've seen so many pictures of what your knee, your genicular artery should look like. And then they get this, what they call blush, where as it's grown, it just gets spread out. And so they stop that blush and try to return it back to how your arteries were. And that reduces so much pain, so much inflammation. And we watch videos of people right after procedures, walking, dancing, being back into the real life.
And a lot of these patients, particularly with PAD, with peripheral artery disease, they're not surgical candidates. So they can't have a knee replacement. If they have osteoarthritis in their knee, they can't have knee replacement. And they need to walk to grow the collateral vessels that reroute blood flow around the blockages in the arteries. And so these embolization procedures are really a game changer. But we haven't talked about how many different areas that embolization has grown into. Plantar fasciitis in the foot. My dad is getting ready to go see Dr. Sid Rao later this month to have his hands done with osteoarthritis in his hands. He can barely move his hands. And this new procedure, embolization procedure in his hands, could help, bring mobility back. There's shoulders, right? You were mentioning just before the show, there's thyroid. I heard there's back embolization that can be performed as well.
Yeah, first of all, just Kim, you were on my mind earlier because one of the doctors presenting, it might have been Dr. Rao, just came back to that the number one thing any medical provider can do to help a patient have a longer life is get them to walk more. And he's like 6,000 steps. And so he's like, if we can take that patient, regardless of what it is, and get them out of pain so they can start walking, doing things, the rest of their life is easier. So I knew that would hit home with you on that. But yeah,
And
oh, go ahead. I'm sorry.
nope,
From
it's
an
all
MS,
you.
from an MSK standpoint, so today some of the conversation has been shoulder. We've been talking about plantar fascia, different versions of the heels. We have knees. There had a talk on potentially doing cervical, potentially doing lower back and hip. Obviously, there's varying
Wow.
levels of complication in different ones of these, and that's something they're discussing as well. But pretty much the idea is at some point, if there's a joint and there's arthritis, they can be embolized.
And there's so many different doctors that are involved. And I'm glad that everyone's coming to the table to learn about these new innovations, to have different options so that these patients don't walk away without any hope for relief for their pain and end up sedentary and not being able to walk.
No, and we're going to have a few on hopefully in a few minutes here, but just talking to some of the patients that have gone through
Wow.
Val's clinic. And there's this one cute woman, I hope we can get her in here, but she's had her shoulder done, her knee done, her foot done. And she was just so excited. Like she couldn't shout it from the rooftops louder.
It's amazing. How does it last? Have you talked to patients to find out how long these embolization procedures last, 1, 2 years, and then they can have it again?
Yeah. So
Possibly.
the official is, as of right now, we can say that we've seen results lasting for up to 2 years. There
Okay.
are studies showing it's gone longer, but that's right now the safe answer that we can give. But I mean, if that gets you 2 years to get walking, to get healthy, to get shape, and there's no pain, and the worst case scenario is it just doesn't work. There's no real downside to that happening.
That's incredible. So I can't wait to dive deeper into the conversation, get to these patients, get to other doctors that are at this particular event, hear what they have to say. But first, in honor of Dr. John Phillips, let's do a moment of inspiration.
Dr. John Phillips, spectacular vascular moment of inspiration.
All right. So one of my favorite quotes is from John Ortberg, and it's the problem with being right is not hurting someone with it. And I think as providers, often you guys know the answers, but how do you keep someone safe emotionally and as a patient without making them feel dumb? So that's my quote of the day.
And I think that that also fits into the conference of the day, which we're going to get to in just a moment. But first, we have to have a word from our sponsors. So stay with us right here on KDOW in the heart of innovation. Don't go away.
Do your legs hurt when you walk? Do you feel cramping or numbness that makes you stop and rest? This could be more than just getting older. It could be peripheral artery disease, also called PAD. PAD happens when arteries in your legs become clogged, limiting blood flow. And when blood can't flow, your health is at risk. PAD affects millions worldwide. If you have diabetes, high blood pressure, high cholesterol, or if you smoke, you're at higher risk. Symptoms may include leg pain when walking, slow healing wounds, or numbness in your feet. Some people don't notice symptoms at all until it's too late. PAD is serious. It can lead to amputations, heart attacks, and strokes. But the good news, PAD can be treated if caught early. This September, take a step for your health. Talk to your doctor. Ask about a simple PAD screening test. Protect your legs. Protect your life. Every step matters. Walk strong, live long. Get screened for PAD this September. For more information, visit padtest.org or call our LegSaver hotline, 1-833-PAD-LEGS.
Welcome back to the show. Dr. John Phillips is off saving some piggies, but I'm joined by a guest co-host pinch hitting for JP, good old Dr. JP. It is Justin Lesh. He is the CEO of Patient Pro Marketing. They're specializing right now in working with clinics on embolization. They help to bring patients and educate patients about embolization. I know they're getting into PAD as well, but this conference is about embolization. It's for people that have osteoarthritis and trying to bring together all of the different practices to make sure that everyone's working as a team to educate the patients on the different minimally invasive options that are available for osteoarthritis. It used to be that surgery was all that was available, but so many patients are not surgical candidates, especially as they age. And so this minimally invasive procedure where they can go after the osteoarthritis in the knees and the plantar fasciitis even in the foot, the osteo in the hands, the shoulder, the hip, wherever it might be looming, even in the back, that's what they're talking about today at Vascular Solutions in North Carolina. But Justin, you have a patient. So my dad, we are flying to North Carolina in a couple of weeks so my dad can have the embolization of his hands for his osteoarthritis. He doesn't have much mobility in there, lots of swelling, lots of stiffness, but you have a patient there with you that had this procedure done.
I'm going to introduce
Khalid Iqbal. Let me tell you my story. I had arthritis in my thumb, left thumb.
Oh, that's where I have mine too. You can even,
Yeah.
yeah,
So
that looks familiar, right?
Very much so. So it was so bad, and it lasted. The pain that I had was getting severe and severe and severe. My movement was restricting every time, and I could not open any jar. I could not push anything. I could not hold anything in my hand. It was getting worse. So, as a matter of fact, there was a talk this morning, and they were talking about three things: the severity of pain, and the severity of movement, and the stiffness. So these are the three. And they were rating it, and there was a study done on it. So I thought, wow, if I put myself on it, my severity at that time was in the high 90s. It was so bad. I would get up in the morning with a lot of pain in my hand, and it would last. If I would use the hand in a wrong way or anything. But then I came over here, and Amir said, Baba, why don't you try embolization? And see, my wife had that done before, I think a week or so before, and she could walk almost right away on the next day.
She had it in her knee.
On her knee, and she walked for 5,000 and some steps.
She was very proud of her. They mentioned that earlier.
And they mentioned it. They actually have her on.
I love it.
Amir is so, what should I say? He was videotaping the whole thing, and we had no idea from behind. And so anyway, he introduced me to Dr. Rao, and one of the things that I must say that Dr. Rao is a very good doctor in the sense that the first thing he does is to explain what's going to happen, and he puts the patients at ease. That's what he did to me, at least. Oh, there would be no evasive issue. There would be no cutting. All you will do is we'll go into your artery through a very thin tube and do whatever they do.
Can you describe what you went through for the procedure, the day of the procedure? Because my dad's going to have it done. And of course, I'm sure he's 100% tuning in right now.
Very easy. It's very easy. It's local anesthesia, not even anesthesia, just numbing of the place. Where they enter it, they enter in one of the arteries going into that area. And what they do is don't even feel anything. I didn't feel anything at all. And it lasted less than, I think, only 30, 40 minutes. That's all the procedure was. And he was quite severe, elaborate with that. And then in the recovery for an hour, or maybe a little more than an hour, and their staff is wonderful.
So talk about,
everybody would make you feel comfortable.
Talk about the sensation of what you were feeling during the procedure and then after versus before. Oh, you really didn't feel anything? Oh, wow.
I didn't feel anything. I don't remember feeling anything.
And then afterwards?
Afterwards, No, I was moving my thumb. As a matter of fact, the next day, I live in Virginia, as I said. I drove to Virginia the next day using my hand.
Oh my goodness.
Oh yeah.
Because we're going to visit Dr. Rao. He's doing one hand. Did you just have the one hand or did you have both?
One hand, my left hand.
Okay, my dad's going to have both, and then we're driving to Danville, Virginia afterwards, and he's you know, dead set on he wants to drive, and I wasn't sure if he'd be able to, but that's encouraging that you were able to drive with no problem
I was able
afterwards.
to drive. There were two of us, me and my wife. We drove back.
Okay.
No problem.
Can you open a jar? There's the big question.
I could. I'm a mechanical engineer by profession, so I'm retired now, but I still like to fiddle around with some tools that here and there at home. That's my hobby, and I couldn't hold any tool in my left hand before. Now I can.
But I just want to thank you for
fantastic.
coming and sharing your story. Seriously.
My pleasure. It's my honor. Thank you so much for sharing it. I think it's a wonderful procedure.
That's incredible. This new embolization procedure, I mean, there's risk with any procedure, and there are protocols still for every type of treatment for osteoarthritis. I mean, you have the injections, the cortisone shots, anti-inflammatory shots. You might even have other things that your doctor maybe even will put you through physical therapy. That's why this conference is so important, because there are stages before you even do get to a procedure, getting to an embolization procedure. You don't just go willy-nilly into a procedure. When my dad was preparing for his embolization procedure with Dr. Sid Rao asked him very specific questions about what he's tried before. My dad's even tried stem cell. He's had the cortisone shots. He's had some natural anti-inflammatory injected in there, because a procedure is never frontline treatment. You have to do conservative methods first. Right, Justin?
Absolutely. And every procedure is different. And since we're talking about different procedures, I want to bring in another patient that I am just super excited to talk to. So this young lady, Judy, had a frozen shoulder. And tell us a little bit about your story with your shoulder there.
Have 2 tariffs to go with. Yes, sir. The first time I went to see Dr. Brown, he noticed I couldn't shake hands with him very well. He said, "Where is this pain coming from?" And I'd gone for my foot, my foot and my leg. And he said, "We got to do something about that." And I said, "Well, I'm a widow and I live by myself. I can't do shoulder surgery." And they say the only thing, the whole replacement. And I said, 6 months recovery. And I had it done on this arm when I fell years ago. And I recovered in 3 months, but they said 6 months. But I know at 70 some years old, I wasn't going to go back and do that again, all that pain. So I said, "Go ahead, anything you can do, I'd appreciate it." So we went ahead that day, and then the next time I went in, he said, "Can I take some x-rays today?" So we did. And so the next time I went back, he said, "Can I take 2 more x-rays, a different, position?" So the next time I went in, he said, "I figured out something." He said, "If you want to take a chance," he said, and, he saw me in all the pain. He said, "It's either going to work all the way or it's not going to work at all."
And that's where we're going to get to the rest of her story in a moment and find out exactly what Dr. Sid Rao did to improve this patient's pain without major surgery. That's next, right here on the Heart of Innovation on KDOW. Don't go away.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here. Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should, because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for. Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 2 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back to the show. Dr. JP is off saving some piggies today. We are honored to have our guest co-host, Justin Lesh. He is the CEO of Patient Pro Marketing. He is live in North Carolina at an embolization conference, and he's with a patient. Justin, who do we have here, and what are we talking about?
So I guess I want to introduce everyone to Judy. And Judy is a patient of Dr. Rao, who's one of the ones hosting this convention. And Judy went in initially for a consult for her foot. And as she went to shake the doctor's hand, he noticed her arm was a little off. What she didn't notice, or what she hadn't mentioned, was her shoulder had been frozen. Now, she'd had a previous shoulder injury, and so she didn't even want to touch it. But it was to the point, you can correct me if I'm wrong, where you couldn't open your microwave. You couldn't eat food with, a fork was too heavy because there was so much pain.
Right.
So you see Dr. Rao. What did you get done? How did that work?
Well, all the orthopedic people had told me I just had to live with it or have surgery. Dr. Rao said, I can fix it. I think I can fix it. And he figured out something, and we got it scheduled, and I walked in, got it done, and walked out. Praise the Lord. I can do anything with my arm.
So talk to me about the day you go in, the procedure. What did you feel? How did it go?
Well, it's not anything, of course, get you ready for the operating room. You don't have to take off except what clothes influence that. They give you a shot. When I had that done, and when I had this done, I had one little, the tubing or whatever they put in, it started there. That was the only thing had to heal up. You don't have anything going on here. They do it all by computer. And Dr. Rao's on this side, and the computer guy's on this side, and you can see it, a little micro, but they go in there and do something to your blood cells. And when you go out, you are good to go.
So how long after did you start noticing relief?
Immediately, just like the lady on the example they had today. It was immediate.
So now you've had your shoulder. What else have you had done?
I have had my knee replacement. Now that got sore for a day or two, but it was worth it because, like I told you, I can kick.
And just to be clear, she didn't have a knee replacement. She had a GAE, or genicular artery embolization.
Right. Okay. And I had also, when I first went to him, went for my foot, and come to find out I had 95% blockage in this right side. I had a blockage in here. So I went, and I had one needle mark beyond my ankle, and they went up my leg and came in here and got rid of the blockage, and no recovery or anything. I had to take it easy for 4 or 5 days. But then it was like I couldn't even push the accelerator because of the not having enough blood flow. And then it was just like a miracle. It's like a miracle. I wish everybody knew about it.
So you told me earlier, and I just want to ask, from a percentage wise, how different is your life now?
50%. I had gotten so I couldn't go to my son's. It's an hour away. It hurt to do that. And with my knee, I can do that. I spent this past week in my yard power washing, doing some painting, trimming with the trimmer, the electric trimmer. It's Katie Barter. I can do anything I want to, really.
Well, Judy,
I'm thinking that it's 90% better.
I think the number's a little low. Well, Judy, thank you so much for taking the time. And I know your son's here to take you home, but thank you for coming and speaking at the convention, for speaking to our audience.
Judy, thank you so much.
Tell everybody, because especially for us elderly people, I'm almost 78, and for my older group of my age group, they call me the brochure. I'm a brochure addict because I get brochures every time I go to Dr. Brow's office. I get brochures and I hand them out. This past week we had 15 members of a retirement center. I gave every one of them where I used to work.
Good for you.
Because they're all my age. We're all retired, and and some of them have had some really bad experiences, with the regular normal surgeries. And so there's several of them. I'm going to find them, and I've had one patient that went and they can use it, but you have to be acceptable for certain things, but they are awesome. Awesome.
Well, Judy,
Judy, you're such an inspiration. Yeah, we really appreciate you so much for joining us here. And I mean, Justin, just a great example of the perfect demographic for that's not a surgical candidate. I mean, at 78 years old, you don't want to spend 3 to 6 months recovering from a major surgery. So having embolization procedures as an option to discuss between the patient and the doctor is really incredible. And particularly with peripheral artery disease, those blockages she has in the artery in her legs, she needs to walk to grow those collateral vessels. And she couldn't do that if her knees were bothering her as well.
Correct.
So it's nice to have these minimally invasive options, not only for the arteries, but also to take care of the osteoarthritis. Thank you so much, Judy. We'll be back in just a moment right here.
Just
the heart
tell
of the debate.
everybody. It's awesome.
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane. The protocol is to send them to amputation. Always get multiple opinions.
We do have options. We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back to the show again, Dr. JP. Yep, he is off saving those piggies, but we're so lucky. Pinch hitting is the CEO of Patient Pro Marketing, Justin Lesh. He's live at Vascular Solutions of North Carolina at a conference there where they're focusing on multidisciplinary care to resolve osteoarthritis, a pain in every part of your body, I can imagine, right, Justin? They're trying to resolve.
No, and it's crazy to hear about all the things that are happening. And I think the best part of this is exactly what we're going to hear right now from Dr. Singh. So Dr. Singh is an orthopedist, which normally doesn't happen in an embolization conference, as I can tell you. So I'm really excited to have him here. Dr. Singh, kind of just tell me a little bit about how you guys are tying the orthopedist and embolization space together.
Absolutely, Justin. So the orthopedic, as you know, is a specialty that deals with bones, but is not very good at dealing with when bone surgery also continues to give pain in that joint. And we kind of proudly, in a very weird 1980s way, kind of dismiss that patient, dismiss that pain, dismiss that inflammation that comes after surgery. A lot of times we fix the problem, which is majority, but that last 10%, last 8%, last 12% of people who we did everything right, yet they have pain and inflammation, itis, inflammation, synovitis, capsulitis. When that happens and we dismiss the patient, it's a defeat, not for the patient, but from our side also.
Wow, so you can actually, you feel that, like you actually take that personally.
Yeah, and as I was telling Justin earlier, it's kind of a funny but actually happens story. Patient says, "I still hurt," and let's say I've done a knee replacement, and I say, "Your x-rays look good," and patient says, "But my knee swells, but your x-rays look good," and patient says, "But I can't walk too well, but your x-rays look good." At some point, I'm only telling them what I have accomplished, but I'm not really answering the question they're really here to answer, which is, why am I still hurting? Well, the moment you tell them you're inflamed, okay, I'm inflamed. What are you going to do about it? Am I going to just say your x-rays look good and that's that? Or am I going to find a way to uninflame that joint? So that's where the embolization procedures are playing a good role, not only after surgery or failures of surgery, but also maybe avoid surgery, maybe prevent surgery, maybe able to get them a quality of life before even offering a surgical intervention, which generally we kind of, hopefully we can keep it as a last resort.
And so you don't look at it as they're taking your patients away. You look at it as adjunctive therapy, even just part of the steps before you do a surgical procedure. But also, you look at it as you have an additional option for patients that are not surgical candidates, which we're seeing, especially in those who are diabetic and also who have poor circulation in their legs, known as peripheral artery disease.
Absolutely. So I look at it as not losing my patients. I look at it as gaining more, if you think about it from the other side, because it's not, again, it's not business is not the end of this whole thing. The end of the bottom line reason is, can I make my patient better? Whether that be somebody else's or my own patient. And if they're not feeling better, what am I missing? Just like, biology and chemistry came together to create biochem, a whole completely new department, which then ventured into more findings of what each one of them was not finding. We are combining the same thing here, where the bone guy who's living in the bone world doesn't know how the blood flow works, and the blood flow guy is living in the world where he doesn't know how the nerve works, and the nerve guy is living in the world where he doesn't know how the bone works. Why don't we all come together and add to each other's expertise rather than take away from each other's expertise?
I want to hop in. Dr. Singh mentioned something earlier that I'm totally going to steal, but he said if your body is a house, where does that fit in? So if you want to share that, because I'm not going to take credit for that.
So let's say, Kim, you tell me, hey, Mr. Contractor, come and build my house. And I come and just put walls there and windows there and walk away. You'll be, hey, what about the blood flow, meaning the water flow? How about the sewerage system? Oh, oops, that's not my job, but your house looks good. It's okay, but I can't live in it. But your house looks good, but I can't live in it. But my house looks good. See where I'm going with that? Same thing now. So you say, get me the water flow guy. What if you just put the water flow in the house, but not put the walls and windows? That alone is not going to serve you. That's not a house. What about the electricity? What about the bulbs? What about the switches? And what about the electricity that hides in the walls to give you electricity? What, you need that too. So all three components make the house, right? Same here. I'm the wall guy. I'm the bone guy. The electricity guy is the nerve guy. And the water flow guy is the vascular guy. We all have to come together to make that house function. And that's how we deal with a joint now. Not just my angle, not just the wall or window angle, not just the electricity angle, or not just the blood flow or a water flow angle.
And that's the whole.
Do you find any? Go ahead.
The whole concept of this multidisciplinary conference is, how do we see the patient that way, as opposed to just walls, windows, or electrical?
And
as you're promoting this, are you feeling like there's any sort of resistance to this multidisciplinary approach?
Absolutely. Each section of this multidisciplinary approach needs to appreciate the other part and bring it in rather than just simply reject it. And traditionally, we have been rejecting each other. Traditionally, we simply, for example, if I refer to a cardiologist, I don't care what they do. No, try to learn what they do. How can I incorporate that knowledge into what I'm doing? Stuff like that. And so blood flow, electricity, nerve flow, and bone flow all need to come together almost on every joint all the time to make it a multidisciplinary approach.
Thank you so much, Dr. Singh. Appreciate it. Appreciate my co-host out there on the spot, live, the Vascular Solutions of North Carolina Conference. We'll be back in just a moment right here on KDOW, the Heart of Innovation. Don't go away.
When
When your sugar runs high, it's more than a sign. Diabetes creeping in, it's a dangerous line. Pre-diabetes too, don't think it's too light. It can lead to PATS, so start the fight. Sugar's sweet, but the cost is real. High blood sugar makes your arteries feel clogged. Slow flow, it's a ticking time bomb. Catch it early, stay strong, and keep your legs on. Sugar's not so sweet when your leg is in pain. Not controlling sugar is where peripheral artery disease sets in. Got sugar? Get checked. Don't wait too late. Save your legs, save your life, take control of your fate. Leg pain, cold feet, neuropathy too. These are signs diabetes caught you. High sugar's the link where circulation and pain left untreated. Your leg might end in flame.
Everyone, welcome to the show. We are rounding out third here, as Dr. JP always says. He's off saving some piggies right now, joined by co-host who is pinch hitting for the day. We have Justin Lesh, who's the CEO of Patient Pro Marketing. He's at a great embolization conference at Vascular Solutions of North Carolina. You've got a great guest out there to give us some final thoughts, so I'll let you take it away.
Yeah, I am here with the COO of Vascular Solutions North Carolina, Amr. And Amr, I guess my big question to you is, seeing all the amazing multidisciplinary workings here, how do you think that's going to get played? How does that play out in the actual clinic setting?
So that's a really good question. I think, first of all, I think that, we had great sessions, we debated, we talked ideas, discussed with multiple disciplines. So one is the knowledge that they gain from here. I think they take it back into their practices and they implement it. Secondly is we hope to have many more of these so we can continue the discussions and build upon it. What we've learned today, and this is a very new field and it's still in its infancy and growing. So I think there's a lot more to come yet, but this is just the beginning and a great start.
And then just for you guys, I know you've been doing this for a while, but like how satisfying is it to watch patients come in and just get to see this whole continuity of care?
It's amazing. We had 5 patients that came in and shared their story, and it's very interesting I'm sure for them to see the other side of it, from how physicians come to grow these types of newer technologies and how they learn about it and how they share ideas and that they were able to participate in it. So it's wonderful, I'm sure, from their perspective. And from us, of course, it's amazing to see that they're still doing well and the fruits of your labor in action. So
for anyone that is looking for more information about the next conference or any trainings, how can they find out?
Absolutely. If they go to www.raoclinic.org, that's RAO clinic.org.
This is something that's very personal for you, Amr.
Yeah,
we talked to your dad and we heard your mom had it too.
That's right. My parents are poster kids, as they say, for this procedure. My mom had both of her knees and shoulders done, and my dad has thumb. So I'm a true believer of this. I'm passionate. You can't, I live with them. I know exactly how it works. So yeah, it's been amazing. Quality of life and seeing them both much more happier, being able to do things that they weren't able to before has been really just eye-opening, amazing, and heartfelt. So
I'm doing the same for my dad. So I'm believing in you. And if you're trusting your dad and your mom with Dr. Rao doing the embolization of both the knees and the hands of your parents, well, then I can trust Dr. Rao, I think, to handle my dad's hands. Thanks so much, everyone, for joining us. Thank you to my special guest co-host, Justin Lesh. Have a great weekend, everyone.